Hello, my name is Camille Herstick, and for this presentation I'll be discussing the placement I undertook this semester with Capital Health Network, otherwise known as CHN. For this placement I worked around 40 hours in CHN's office in Dixon under the supervision of Melissa Hobbs. But before delving into what I did in these hours, I first want to provide you with an overview of CHN so you can have a better understanding of the project that I completed for this placement. So CHN was established on the 1st of July 2015 under the Commonwealth of Australia's Primary Health Network program. This organisation represents the next stage of the evolution of primary care organisations in the ACT that started around 20 years ago with the division of ACT Division of General Practice, and in more recent years with ACT Medicare Local. It is the ACT's primary health network. Their vision is to have a connected health and community care system that incorporates all public health services to ensure that the community is receiving the best health service possible. CHN's health programs aim to identify and improve the health of people in the ACT by identifying and addressing the health needs in the ACT community. Although the purpose of CHN is to facilitate better health outcomes for all of the ACT community, they have a particular focus on the needs of those in the community who are disadvantaged. So what are CHN's core values? So it is accountability, collaboration, integrity, and respect. So what are their objectives? So their core objectives are to increase the efficiency and effectiveness of health services for consumers, particularly those at risk of poor health outcomes, and improve the coordination of care to ensure consumers receive the right care at the right place at the right time. Furthermore, CHN strategizes to understand the needs of communities in the ACT to commission for outcomes, collaborate services for aligned collective results, channel and leverage resources for maximum benefit, and champion clinical and consumer leadership to improve models of care and services in the ACT community. So what are their aims and how do they endorse them? So CHN have four main aims. The first is better health. This aim outlines CHN's objective to ensure better health outcomes for the ACT community, while simultaneously focusing on vulnerable people and people at risk of experiencing poor health outcomes. This aim is endorsed and supported by CHN through a range of programs. These include the programs Closing the Gap, Health in Mind, Health Pathways, New Access, and Partners in Recovery. These programs all offer different services. Some of the programs support vulnerable populations, such as Closing the Gap, and other programs, such as New Access, offer mental health services to all of the population who are experiencing mental health difficulties. And some programs, such as Health Pathways, provide GPs, nurses, and allied health practitioners access to an online health portal that allows practitioners to access, manage, and refer patients in a timely and effective manner. These programs tie closely into the second aim of CHN, which is better care. This aim envisions an enhanced consumer experience of care and an integrated care system that spans over the entire healthcare system in the ACT. CHN does this in multiple ways, but foremost it is by providing information on aged care and by managing a care coordination and supplementary service program that aims to improve chronic disease and condition management in Aboriginal and Torres Strait Islander people. CHN also does regular needs assessment reports that identify vulnerable groups and aim to assess the literature and review this and re-strategize the current systems that are in place to ensure that the problems are being dealt with in the most effective manner. This is where my placement actually was around, so I did a needs assessment. The third aim is to have a better supported workforce that develops the leadership capability, interprofessional collaboration, and integrated learning of all health service providers in the ACT. So then the final aim is better value. So this aim endorses the need for a system that is actively working, adapting, and modernising its service to ensure that consumers and funders are getting the most effective service possible. The aim also works to encourage market responses that drive improvement, innovation, and integration. CHN works towards better value within the ACT health sector by ensuring effective primary health care reduces things like emergency department congestion within hospitals, supporting the healthcare system by providing expert knowledge on primary health care, and by commissioning the best health services in the ACT region. Okay, so then that comes to the next point. So my placement at CHN. So I was asked to create a needs assessment for the health and wellbeing needs for children in the middle years. That's years between 8 and 12. This task required me to intensely review the literature surrounding the problems that children face during the middle years of childhood and write a report that outlines what the middle years of childhood are and what the main issues that children in these years typically face. Furthermore, I was asked to come up with ideas for ways that CHN could engage their stakeholders and provide them with the information and resources necessary to aid the process of early identification of individuals who are struggling in the middle years and require assistance and services. CHN also asked me to identify vulnerable populations that are vulnerable to experiencing the key issues that I identified. So the description of the work that I undertook. So the 40 hours that I spent at CHN was relatively autonomous. I was given the freedom to research and formulate my own opinions on the topic. However, was given a template of how to write the report so that it matched the CHN needs assessment template. Each day of placement, I formulated a kind of to-do list in which I listed out the things I wanted to do and what I wanted to complete that day. And then I also wrote a plan of how that would fit into my final report. So before starting the day, I showed this plan to Melissa, and she would advise me on the changes that needed to be made and if I was going in the right direction. For the most of the days I was there, I was given the data research on my own and write the report on my own, especially in the first 3 days of placement, in which I spent most of my time purely just researching about the middle years. In the afternoon of each day, I would bring my pen back to Melissa and tell her about the information and the opinions that I formulated throughout that day, and she would direct me as to whether I was on the right track. On the 4th day of placement, I showed my work to Melissa, and she roughly checked it, but this is the day that I actually came up with my idea for my intervention, and she approved it. I had a couple ideas, so she actually told me which one she thought would work with CHN specifically, so that was really helpful. So it was like the idea that I came up with was actually to develop a fact sheet that could be sent out to all relevant CHN stakeholders. This fact sheet would identify the main issues that children in the middle years experience and provide information on the services available in the ACT for children who are in the middle years who are struggling with the key issues identified in my report. For the next 2 days at placement, I gave Melissa a full copy of my report and she edited it and gave me guidance on how to be better on track with what CHN wanted and the kinds of interventions that CHN stakeholders would actually utilise. And therefore, that's what also helped me come up with this fact sheet. So on the final day of placement, I was able to complete my report. I only had to do a little bit of editing, just with full stops and referencing. And then from there, I also only had to do a minor editing for the report that I needed to upload for this class. So it was a really, really great experience for me. So to summarise, I want to show you what the key outcomes of my placement were. So the first was obviously that I completed a needs assessment report for CHN's annual needs assessment report. And I truly believe I did this to my best ability. I spent hours researching and I used the most informative and accurate sources to formulate this report. This was obviously, the most important outcome for this placement. And I did pretty well, I think, because Melissa was very happy with the report I presented and I was very happy with it. So the second thing was that I came up with a viable intervention for CHN. So this outcome was also extremely important. Both Melissa and I agreed that the intervention I came up with was something that CHN could actually develop. So that was pretty exciting. The third outcome was a little bit more personal, And it was that I actually learned how to formulate a needs assessment report successfully in a professional setting using official statistics and methodologies. I'm pretty happy with this, as I was able to learn the skills to write a report that hopefully will make a difference in CHN, and will hopefully one day in the future I could use those skills for an employment in public health. So the next bit is a critical reflection of my placement. So I personally think I performed pretty well in this placement. I tried my hardest to formulate a plan that would enable me to make the most out of my time while I was at placement. However, because this was the first time in an office setting, I did have some troubles concentrating on the computer screen for the extended period of time, but I found I just had to get up, walk around. I established friendship with some of the people in the office, so that definitely helped me clear my mind and come back with a fresh start. The other thing that I can critically reflect on myself is that I actually had trouble finding data that I could use in this report. Because the CHN actually asked me to only include ACT data in my report, which unfortunately is extremely limited in the middle years. I did find a lot of online Australian statistics, but unfortunately they weren't what I was looking for. So that was something that I definitely found difficult. So the workplace itself was really great. It was a fantastic first experience in public health. Everyone was so lovely. Melissa's co-worker, Sine, also helped me a lot with the report. She provided me with some Australian government sources that really helped me formulate my report. Melissa was also a great mentor who was very to the point and helped me a lot with editing my report. I often have trouble with rambling on in assignments, and she definitely taught me to be a bit more succinct and to the point when writing. So the supervision that I was given was pretty autonomous. I was given the freedom to research on my own and formulate a report on my own. In one way, this was fantastic because I did get to formulate my own opinions, but it also meant that I did get a little bit astray at sometimes, and I did end up researching into too heavily into the wrong things. So that was a bit like, that definitely was something that I struggled with. However, because I did that in the morning and in the afternoon to-do list in each day of the placement, I didn't really lose too much time. Melissa was able to put me back on the right track pretty quickly. So that was positive. I think that the outcomes of this placement were successful. However, the ability of CHN to address the key issues that I did identify for the middle years were limited. Thus, my ability to conduct a more rigorous report in this area remained pretty limited. This is due to a limitation in ACT data for children in the middle years, and also because of CHN's limited stakeholders. When I was asked to write this report, it was mainly around what GPs could do to help, and because of the complex and multifaceted nature of problems children experience throughout the middle years, the stakeholders that CHN possesses really do have limited potential to holistically address the key issues identified in the report. Despite this, I still think I came up with an intervention that has the potential to facilitate awareness of the problems that children in the middle years face and effectively improve the health outcomes of children in the middle years and the ACT. So the next step for CHN, I believe, is to seriously consider putting this intervention forth, as I think it would be a great idea, and I think Melissa thought it would be a good idea. So, yeah. To finalise my presentation, I just want to say a huge thanks to Nerida and Melissa for giving me the opportunity to complete this unit and have my first professional experience working in public health. So, yeah, thank you so much for listening to my presentation.